Blepharoplasty in Turkey, the upper and lower eyelids correction. How is it performed? What is required for this? What are the conditions for the procedure? In this video, we're going to talk about circular blepharoplasty. Also, we'll show you a Turkish plastic surgery clinic and meet a doctor who treats foreign patients in Antalya, Turkey. The Healthy Turkey always gives you really informative medical videos. So subscribe to the channel for insights on treatment in Turkey and ask questions in the comments. Renaissance artists painted perfection. Look at the details, no wrinkles. These portraits are quite old. No one could fix the original appearance. But now it's easy. Plastic surgery can bring true miracles. Circular blepharoplasty gets rid of eye wrinkles and smooths eyelid folds, erasing the trace of years and decades. Plastic surgeons in Turkey treat patients from all around the world constantly. Here, surgery can be paired with a nice vacation. The ideal climate and sea air accelerate healing, while the peculiarities of Turkey's medical system make plastic surgery cheaper and more accessible than in many other countries. The main thing is to choose a good doctor in a good clinic. We know them. Blepharoplasty is a procedure with a very high satisfaction rate and a low incidence of complications among patients. Dr. Ugurkan Şener, a plastic surgeon in Antalya. He finished his studies at the Ordu Scientific School, graduated from Gazi University, specialized in a research hospital in Ankara, and worked in the provinces during his compulsory service. Thus, he has gained substantial experience in aesthetic and reconstructive surgeries. He is a member of professional associations, married, and interested in sports and literature. Blepharoplasty is surgery to improve the look of the eyelids and eye shape. This procedure is typically categorized into two types, upper blepharoplasty and lower blepharoplasty. Both procedures can be performed simultaneously or separately. If necessary for the patient, it is significantly easier for us to operate on both the upper and lower eyelids simultaneously. In this case, it becomes simpler to achieve the desired shape for the lower eyelid and to prevent the patient from looking tired or old. But currently, the majority of patients typically come to us for upper blepharoplasty. And since upper blepharoplasty also affects visual functions due to the removal of excess skin, after the surgery, patients quickly find not just alterations in their appearance, but also the significant improvement in their vision and the expansion of their visual field. And they are pleased with the results. How hard is this operation? What does the surgeon do exactly? Could you tell me more? We conduct upper eyelid surgery with only local anesthesia when this is the only operation planned. During this procedure, which takes about 30 to 45 minutes, we create a cut in the upper eyelid area based on the design marked "O the skin," and then we remove the surplus skin and the surplus muscle beneath the eyelid and any excess fat tissue if there is any, and after suturing, we place a dressing. Eyelids are among the tissues that heal most effectively in the body, leaving almost no surgical scars. There are several techniques for lower eyelid surgery. This surgery can be performed from the inside of the eyelid, or it can be done just below the eyelashes. We generally prefer to do the surgery under the lashes. The main parameter that determines the type and style of surgery for lower eyelid surgery is the amount of fatty tissue in the patient's cheek area and under the eyelid. If there is too much fat, we can remove it. However, if they create a specific indentation, we fill it by substituting that fat instead. This way, we achieve a more even eyelid appearance, enhancing expressiveness and removing signs of fatigue and an old, tired look. What risks are associated with eyelid surgeries? Are there strict contraindications for such procedures? I can say there are no active contraindications for eyelid surgery. However, if patients have undergone this surgery at a very young age and wish to repeat it later in their life, it should be taken very seriously because the excessive skin removal can cause eyelid retraction. Additionally, excessive removal of skin and muscle in lower eyelid surgery may lead to sagging eyelids. And in time, the eyes may even stop closing. Dryness and burning sensations in the eyes may occur. Therefore, such surgeries should be performed by a specialist doctor with sufficient experience. Are there cases when the initial plan has to be altered during surgery, and how does this impact the appearance of the patient's eyelids? In fact, there isn't a single patient whose plans I deviate from too much during surgery, as I conduct a thorough and serious examination of patients prior to surgery. The only time I might deviate from the plan during eyelid surgery is if it benefits the patient. In cases where there is extra fat that I missed during the pre-surgery assessment, if you remove it during the operation or alter its position and shape, it will ensure a beautiful appearance. Thus, any changes I make to the surgical plan won't negatively affect the appearance. Every surgical procedure and its preparation demand the best available equipment, and that should never be overlooked, even for operations that seemed easy and routine, because it's still an invasion in the body. The clinic's equipment and staff qualifications affect not only the procedure's quality, but also the absence of future complications. So it's important to choose your surgeon and hospital wisely. We talked about the risks of neglecting this in one of our videos by this link. Check it out and be careful. For problem avoidance, I really recommend asking specialists who know the Turkish healthcare system well.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkey, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home.
What limitations do patients face post-surgery? What advice do you provide to them? After eyelid surgery, patients may experience significant swelling and bruising, especially in the first few days. This is more common among the group of smoking patients. Patients are strongly advised to avoid smoking for a specified duration. Patients should also avoid leaning their heads too far forward, as this significantly increases swelling around the eyes. After surgery, we recommend applying cold compresses and not to forget to do it at specific intervals, for example, 10 minutes every hour. If patients stick to these timelines, the swelling and bruising will go away sooner. We suggest minimizing water exposure, especially in the early days. We use special dressings, so we advise against frequent contact with water, and if we recommend creams for the stitches, patients must use them exactly as we suggest at designated intervals. How long is the rehabilitation period following surgery? I can say that the answer differs for upper and lower blepharoplasty, but on average it may take about a week. Usually we take out the stitches on the upper and lower eyelids on days 6 to 7. Spending this time in Antalya is crucial for me to see my patients. After the surgery, we demonstrate different massage techniques to patients, both from the top and bottom, to lessen swelling and better attain the desired appearance. In average, 6 to 7 days will be sufficient. Turkey offers a unique, comprehensive approach to patient care. In other countries, each procedure often incurs a separate fee. Healthy Turkiye Company manages the organization of these trips, based on all-inclusive principle, working exclusively with trusted specialists, in both medicine and in the hospitality sector, coordinating all their work for each patient. Healthy Turkiye handles everything, from consultations and arrangements with the clinic and doctor, to transfers, lodging, migration formalities, and translating medical records.
You can see the company's website address right on your screen. This site allows you not only to consult, but also to find information about other quality medical services in Turkey. We're regularly telling you about treating different diseases and the care of medical tourists in this country. So, do subscribe to our channel to catch new videos, and we appreciate your likes.